I'm currently a mental health resident with Latte Wellness. My background is in treating refugees who've experienced trauma overseas. I work with immigrant populations and victims of child sex trafficking.
Let's get into the question. So our first question on this episode is complex trauma and CPTSD the same thing?
So, complex trauma generally describes a child's exposure to numerous adverse traumatic events. And these traumatic events can be ongoing over a period of time. And generally speaking, the events are severe in nature. And when we hear the term, quote, complex trauma, this is often in reference to a child that has experienced many episodes of profound abuse or neglect. Complex trauma can produce symptoms of anxiety, avoidance, and flashbacks. Because complex trauma usually involves children, this means that the exposure to trauma has happened during a time when the individual is still developing. So complex trauma can impact a person's developmental trajectory and make emotional regulation difficult and damage or distort that person's developing sense of self-concept. So CPTSD is essentially a way of describing post-traumatic stress disorder symptoms that are more pervasive than the standard post-traumatic stress disorder diagnosis. CPTSD is often seen in victims of sex trafficking or in people who live in the midst of war zones where they're exposed to ongoing chronic trauma. But notably, CPTSD is not in the Diagnostic Statistical Manual of Behavioral Health Disorders, Edition 5. CPTSD is commonly used to describe emotional difficulties that develop after prolonged exposure to trauma. And CPTSD usually refers to an overactivation of the stress response, which results in flashbacks, anxiety, avoidance, and more. CPTSD is listed as a diagnosis by the World Health Organization, but it's not in the DSM. In fact, CPTSD is somewhat controversial because a number of mental health experts actually feel that CPTSD is actually another type of borderline personality disorder, while many experts disagree.
All right. So the question two states, how can I help my girlfriend heal from her complex trauma?
So, if you'd like to support a person close to you in overcoming experiences of complex trauma, the most important thing that you can do is support them by encouraging them to seek professional help. If someone close to you is struggling with their emotions, you can offer to accompany them to treatment. And most importantly, have compassion for that person's suffering. If your partner is LGBTQ+, a great way that you can offer support is by providing him or her with the phone number to the Trevor Project, and you can call them. Their number is 1-866-488-7386. And the most important thing you can do is to encourage your partner to seek competent, qualified professional help. And of course, in an emergency situation where someone is facing imminent harm, always call 911.
Thanks for the clarification. So the question here states, is feeling anger a necessary part of healing from complex trauma?
So every person's healing journey is different. Many practitioners believe that the gold standard for the treatment of complex trauma is CBT. That's cognitive behavioral therapy. And some people find that EMDR, or eye movement desensitization reprocessing, brings them some relief. In my opinion, I don't know that it's necessary to feel anger. However, many clinicians would probably agree that in order to feel better, clients must confront the event to some degree by lessening the level of avoidant behaviors. So while there are no medications approved for the treatment of CPTSD, some clients find relief through psychopharmacology, which can be obtained by speaking with a licensed psychiatrist.
Okay. So yeah, definitely. Everybody's healing journey is different, and while some may go through anger, some definitely do not need to go through anger to heal. That's totally understandable. Um, Question 4 asked, how common are revenge fantasies in those with complex trauma?
So if you want to learn more about the study of revenge, I recommend the book Radical Revenge by Renee Danzer. So, in a 2011 article by Eric Jaffe published by The Observer, when individuals contemplate revenge, studies have shown that the caudate nucleus lights up. So, essentially, those findings indicate that in contemplating revenge, a portion of the reward center of the brain becomes very active. So, from this perspective, we can see how revenge fantasies may actually serve an evolutionary function by providing the victim who seeks revenge with a sense of control and reward just via mere contemplation. From a sociological perspective, the act of taking revenge is very different than the thought of taking revenge. The act of taking revenge can trap individuals in a cycle of retaliation, which can actually prolong healing. But on a side note, it's very important to differentiate here that pursuing justice and pursuing revenge are also often not the same thing. In therapy, it's often important for individuals to allow themselves to fully feel their emotions, but that's not a prerequisite for healing. In fact, if we look at grief, we find that people who don't express grief are not necessarily at risk by not doing so.
So I actually like the differentiation between contemplating revenge and the actual act of taking out revenge. Yeah, I think it is true that you feel a certain there's a certain reward system when you actually contemplate what you want to do, but most often than not, some people go through it, some actually don't go through with the revenge contemplation. I think that differentiation is very important.
Yeah, I agree.
How long do patients with complex trauma need therapy?
Every individual is unique, and thus every individual's treatment is unique. The length of treatment depends on the severity and duration of symptoms. And additionally, some clients respond better to a certain type of intervention over others. So the length of treatment is dependent upon the type of treatment, the severity, and the duration of the individual's symptoms, and many, many other factors.
Which characteristics are often overlooked in someone suffering from PTSD?
So, anecdotally speaking, I think that dysregulation and mood issues, which are very common to folks experiencing PTSD, can be very, very easily misinterpreted as mood disorders or even personality disorders. People in the throes of PTSD are experiencing severe disruption and impairment in their daily lives. And if the clinician hasn't accurately established that person's baseline prior, it's really hard to know what the person was like before exposure to the trauma. And this is where the social justice piece actually comes in. There was an article that was written by Tanya Russell, and it was published by the Child Mind Institute. And it noted that Black teens in the US were more likely to be diagnosed with conduct disorder than white teenagers, even when they were suffering from depression. And additionally, Black adult individuals are more likely to be diagnosed with psychotic disorders, even when those patients show very, very clear signs of depression. So, unfortunately, in making a diagnosis, the negative biases of the clinician can be imposed on the client through misdiagnosis. And most of us interpret the world through our own cultural norms. So when symptoms are missed or overlooked, it's often because of a lack of cultural humility and understanding, in my opinion.
Right, totally. So the the likelihood that a symptom will be missed is actually dependent on whoever is the clinician, whoever is treating the patient. So they're actually diagnosing based on their unique experiences and their pre-existing biases.
I mean, I think most clinicians try to minimize the level to which their bias, especially their negative bias, impacts their diagnoses. But it's unavoidable that all clinicians are humans too, and we
Yeah,
see the world through our lived experiences, and we see other people through our lived experiences, and sometimes those bias, unfortunately, seep into the process.
exactly, exactly. Okay, so question 8: what are the challenges therapists face when treating PTSD, and what changes would you like to see?
Oh, there are a lot of challenges faced with any diagnosis because of ignorance and stigma. And one issue that I personally have is, again, with the social justice piece of this. When you diagnose a client who is using insurance, that diagnosis then goes on their permanent medical record. So often, if the client goes to the ER for something that's entirely unrelated, their mental health diagnosis can be brought up. I've heard of many cases where a client's mental health diagnosis has been used to invalidate genuine physical symptoms, or in which the client's anxiety has been improperly used to advocate for a wait and see approach in the ER. So I would love to see changes to HIPAA in which clients can shield their mental health diagnoses in these settings. As a person-centered practitioner, I believe that clients should have control over their own information. Many people of color have reported to me that their pain and symptoms have not been taken seriously in the ER due to the stigma of mental illness. In fact, in Maryland, our own Governor Westmore's father died uh, due to the emergency room's failure to adequately treat his symptoms. And sadly, one need only to read the review section of some of these institutions to learn that clients are still reporting biased, unprofessional, and even adversarial experiences in some of these settings.
That's quite unfortunate to hear. In today's age of information privacy, you think something like a diagnosis in a whole separate setting would affect another diagnosis, and I think that's quite unfortunate. So our last question is: how do you handle catastrophic thinking?
So, catastrophic thinking is a thought distortion. For individuals who struggle with catastrophic thinking, the worst case scenario is the most real scenario. An example of catastrophic thinking would be to say, if I leave the pop up toaster oven plugged in when I leave the house, even if I'm not cooking food in the pop up toaster, the house is going to burn down and I'll lose everything. I'll be sleeping on the streets and I'm eventually going to die of exposure to the elements. So we know that there is perhaps a small percentage of electronic device failures that do lead to household fires with involvement from pop-up toasters. In fact, if you live in Ireland, the odds are in your favor because there, less than 4% of household fires are caused by pop-up toasters. And if we look at the data, we're looking at about 1,300 total fires per year around the world. So if we look at the data that's provided on JITNUX, we're going to find that less than half of those 1,300 fires were caused by electrical malfunctions. About a third of those fires occurred on countertops where the fire didn't spread because nothing else was around. In fact, even in New York City, not even 2% of household fires are caused by pop-up toasters. So while you might prefer to unplug your toaster when you leave the house, the data tells us that pop-up toaster ovens really are not as dangerous as your emotions might tell you that they are. So if you're a person that struggles with catastrophizing, you can recognize and identify irrational thoughts as they occur and consider outcomes that aren't so severe. And if your catastrophic thinking is impacting your quality of life, seek treatment from a qualified and licensed mental health provider in your area.
Okay, but then is there a link between a person who has, does there have to be a history of maybe, or does there have to be something that has happened, like a precursor to catastrophic thinking? Um, uh, am I likely to have catastrophic thinking if I've suffered from something similar in the past? Is there a link?
So I'm not entirely sure because correlation doesn't equal causation. So just because maybe it often co-occurs with anxiety, I wouldn't be comfortable saying that anxiety causes the catastrophic thinking. I think that we would have to look at the data. We'd have to look at the data on that, and I would take it as a case by case situation because our life experiences often influence our thought patterns. Our thought patterns often are influenced by our culture, by our socioeconomic group, by our level of education. There are so many psychosocial experiences that kind of, you know, result in a person maybe having that. Even I've even seen catastrophic thinking be a value that has carried down from generation to generation to generation. So we have to look at all those pieces.